Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today we are going to talk about something called angular cheilitis. Angular cheilitis is the irritation that many people get in the corners of their mouth. Angular means angle, and cheilitis means lip. So angular cheilitis is the descriptive term for the inflammation and irritation that people get in the corners of their mouth. It's possible to be only one-sided, but is much more common to affect both sides. It's usually worse in the winter. It's typically a condition of adults, but kids can also get it. It's red and flaky, and sometimes it can crack and be painful, especially when people are trying to eat. So the condition angular cheilitis is caused by slight irritation that usually starts from saliva that collects in the corners of the mouth, usually while we're sleeping, because all of us humans drool a bit in our sleep. And saliva has enzymes that break down food, and so the enzymes attack the skin in the sensitive corner of the mouth, and that skin gets irritated and inflamed. Once that happens, there's often a yeast overgrowth that starts, and the whole rash gets even worse. It's pretty easy to treat angular cheilitis and make it better, but people who are prone to it tend to get it back over and over again, so that can be pretty annoying. So often we have to do some type of maintenance treatment to try to prevent it from coming back. To treat it, we start with antifungals and anti-inflammatories. So over-the-counter or prescription, they will both likely work. So the azole creams are the antifungal type that we want to choose, such as clotrimazole or ketoconazole, and I recommend doing that twice a day. Then on top of that, I recommend a low-dose hydrocortisone to reduce the inflammation at the same time, and that can be either 1% over-the-counter or the 2.5 prescription hydrocortisone cream. This is also twice a day, and patients will typically do this for a few weeks or a month or so until the rash is better, and then I usually recommend stopping the hydrocortisone and staying on the antifungal for a bit longer to make sure the rash is really gone. The other intervention that is really important in this rash is to protect that skin in the corners of the mouth before patients go to bed. So we want to prevent saliva from collecting there and irritating the sensitive skin. The best way to do that is to protect that area of skin with a barrier cream, such as zinc oxide paste, or Vaseline, or Aquaphor, or some type of diaper rash cream. That also works. So whatever is easy to find and what works best for the patient is good. If patients need to put something on as the day goes on to prevent cracking and pain, I recommend either Vaseline or Aquaphor or coconut oil. This treatment program works really well for the vast majority of patients. So if you or somebody that you know is suffering with angular cheilitis and you're not getting better, get a consultation with a board-certified dermatologist for help. You want effective treatment and also an accurate diagnosis. So in summary, angular cheilitis is an inflammation of the corners of the mouth. The best way to treat it is with antifungal and anti-inflammatory creams as well as barrier creams, and I hope that was helpful. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.